Hi everyone, I hope you're having a great week. I'm Katharina Kang, Mission Programs Manager at Komen, North Texas. I'm excited to be back with you again for our monthly educational series. If you missed last month's episode about breast cancer treatment, be sure to check it out on our Facebook or YouTube pages. Today we're talking about a topic that may come as a surprise to some people. Breast cancer in men. Yes, men can get breast cancer. Let's take it from the beginning, from puberty that is. Boys and girls begin life with similar breast tissue, but over time, men do not have the same complex breast growth and development as women. At puberty, high testosterone and low estrogen levels stop breast development in males. Some milk ducts exist in men, but they remain undeveloped. However, breast problems, including breast cancer, can still occur in men. You heard that right. Breast cancer in men is rare, but it does happen. In the U.S., about 1% of all breast cancer cases occur in men, much lower than the risk in women. The lifetime risk of getting breast cancer is about 1 in 1,000 in U.S. men, compared to 1 in 8 for U.S. women. In 2017, it's estimated that there will be more than 2,400 new cases diagnosed in men in the U.S. and 460 breast cancer deaths. Since it's so rare, you're probably wondering if there's anything in particular that makes a man more likely to develop breast cancer. Well, just as in breast cancer in women, older age is the most common risk factor for breast cancer in men. The median age of diagnosis of breast cancer for men is 68, whereas for women it's 62. Men with the BRCA2 gene mutation are also at an increased risk of breast cancer. Other factors such as obesity, genetic conditions, and personal health history can play a role too. But although we know these factors can increase risk, most men who are diagnosed have no known risk factors. Fortunately, if a man is diagnosed, survival rates for men are about the same as for women with the same stage of breast cancer at the time of diagnosis. But, and this is important, men are often diagnosed at a later stage of breast cancer. This is possibly because men may be less likely than women to report symptoms, which may lead to delays in diagnosis. Here are some of the warning signs that men should be aware of. A lump, hard knot, or thickening in the breast, chest, or underarm area. Change in the size or shape of the breast. Dimpling, puckering, or redness of the skin of the breast. Itchy, scaly, sore, or rash on the nipple. Pulling in of the nipple or other parts of the breast, or nipple discharge. It's important for men to report these or any changes in the breast or chest area to a healthcare provider. Survival is highest when breast cancer is found early and treated. Don't be embarrassed. Talking about this with a doctor could help save your life. Like most breast cancers, male breast cancer usually begins in the milk ducts of the breast. In some rare cases, men can be diagnosed with inflammatory breast cancer, ductal carcinoma in situ, or DCIS, or Paget disease of the breast. Paget disease of the breast is a rare cancer in the skin of the nipple or in the skin closely surrounding the nipple. It can cause a scaly rash on the skin of the nipple, and this form of cancer is rare, but it does occur more often in men than in women. However, there are also plenty of benign or non-cancerous breast conditions that can occur in both men and women, including gynecomastia, which is the most common benign breast condition in men that results from a hormone imbalance in the body. The takeaway message again is just to report any changes in your breast to your provider, no matter if you are male or female. Be sure to check out Komen.org for more info on breast cancer in men and to read some personal stories from men who have been diagnosed with the disease. Before we sign off today, we want to make sure you're aware of some of the fun activities we have coming up. First, we have our Big Wigs program. This is a program where community leaders have committed to raising a minimum of $1,000 from now through the end of October. You can learn more about our Big Wigs and see their crazy pink hairstyles at KomenNorthTexas.org/bigwigs. This month is National Hispanic Heritage Month. You can learn more about breast cancer statistics and risks for Latino men and women at Komen.org. Next month is National Breast Cancer Awareness Month. We want to thank the partners who are more than pink by promoting our cause and raising funds for the fight against breast cancer. You can see a full list of partners on our events calendar at KomenNorthTexas.org. And finally, we'd love to invite all of you to join us at our Wichita Falls Race for the Cure on October 14th in downtown Wichita Falls at the MPEC. You have several options to register. Register online at KomenNorthTexas.org. Register at Academy Sports and Outdoors this weekend from 10 a.m. to 2 p.m. in Wichita Falls. Register at the Wichita Club from 3 p.m. to 8:30 p.m. on Friday, September the 29th. Or register in person on October 11th through the 13th from 11 a.m. to 6 p.m. at Cal West Hospital. That's it for today. Thanks again for joining us for our monthly educational series, and we'll talk to you again next month.